We will talk about the eruption mechanism of the tooth. And so we have three movements in eruption. We have a pre eruptive, we have the eruptive, and then we have the post eruptive. So here you can see we have the baby teeth, and then you have basically your primary or your permanent that are growing more lingual and inferior to our permanent. And here's something just to look at. So let's do this. So we will start with the first phase or the movement, and that is, I will go in order from right to left, left to right. So here's your pre-eruptive movement. This is everything that happens before the root formation. So what are the requirements for pre-eruptive? It has two requirements. First, you have to resorption of the primary baby teeth or deciduous teeth. So resorb those and also have a eruption mechanism involved to for root eruption. What is the direction of the jaw and the tooth germ as they grow? The tooth germ grows out and up as the jaw grows in size. So the anterior germ is going forward, and the posterior um, germ is going backwards. The clinical application that you can have with this is that if there's not a resorption of the primary baby teeth, the defect that we get is called cleidocranial dysplasia. And here you can see the guy from the Stranger Things. So you have missing teeth, or you have resorption of the baby teeth. You also have this clavicle that comes together, narrowing of the shoulders. So this is just a basic example of cleidocranial dysplasia that can happen during because of the pre-eruptive mechanism. Then we go into the eruptive mechanism, and that happens during root formation. So what is eruption? Define eruption. It is the occlusal movement of the teeth. So occlusal meaning axial or up. So it is occlusal movement of the teeth into its functional occlusal plane. So into our occlusal or bite. Histologically, what should be present in eruptive? So you should have all of the periodontium elements. You have the dentin, the pulp, cementum, PDL, and the alveolar bone that are forming at this stage. The mechanism, there will be three mechanisms we will talk about, but the best mechanism that works is the PDL turnover. So because of the high collagen turnover in PDL by the fibroblast, and with the help of the eruption mechanism, which is the gubernacular cord, that is how eruption happens. So we have a question here. PDO develops after initiation of the root is remodeled by the traction forces of the fibroblast. So that is how PDL is remodeled, by the traction of fibroblast, and what delineates the eruptive pathway for the tooth, and that is your gubernacular cord. So as you can see here in the image, you have this dental follicle with a cord that connects itself to the oral epithelial outside and to the tooth. And as it resorbs the bone, it forms this canal for eruption. So you can see the movement out, and then here the tooth will be able to penetrate through. Finally, the last one we have is post-eruptive. And in this stage, you're in function. So this is a functional tooth. You're in occlusion. And post-eruptive, the goal of this is to provide growth, accommodation, and occlusal clearance. So as the jaw grows and for occlusal clearance, we need these post-eruptive or changes in the eruption. The clinical significance of this one is that if you do not have proper eruption, your roots get stuck directly to the bone, and we call that ankylosis. And ankylosis is seen here. As you can see, the tooth is basically below the occlusal plane. Once again, it dips down below the occlusal plane. And you can check that by percussion. So histologically, compared to the eruptive where all of the periodontium was present, Here, histologically, what's happening is that you have a remodeling of the alveolar bone with the help of PDL, and you have this circular cementum, the thicker cementum that is forming at the apex to really support the tooth structure. Mechanism of post-eruptive, once again, is your PDL collagen turnover with the help of fibroblast with those traction movements or the traction um, power. The three theories of eruption that there are root elongation, which says that the root growth forces the bone resorption, causing tooth eruption. You have the alveolar bone remodeling mechanism only, but the one that works and the one that we use is a PDL formation. So it's a follicular tissue, and as PDL erupts because of the collagen turnover due to those fibroblasts traction power. And once again, you have the signaling of the reduced enamel epithelial with the dental follicle, and that is what triggers the PDL collagen turnover. And lastly, we will talk about the shedding. Shedding is due to osteoclasts, the bone resorbing cells. As the root grows, you have the fusion of the reduced enamel epithelial to the oral epithelial. And then another component is called the junction epithelial, and that is for the enamel protection. So it is basically like a sac or like placenta for the baby around the enamel itself. As you can see here, we have the oral epithelial outside. After that, we have the connective tissue. After that, we have the reduced enamel epithelial formed by the post-ameloblast. And then finally, we have the enamel. Here you can see that enamel going outside. We have the primary enamel cuticle that is basically like a basement membrane. And then you have the reduced enamel epithelial, which forms from the post-ameloblasts and is the most outer layer. Okay, so that is our tooth eruption. We talked about basically pre-eruptive movements and their two requirements of primary tooth resorption and a mechanism. We talked about eruptive movements, which happen during root formation. And in this point, histologically, you should see all of the periodontium present. The mechanism is with the PDL turnover and the gubernacular cord. And then finally, we have the post-eruptive, and that's when you are in functional occlusion, and it is for growth accommodation and occlusive clearance. And histologically, you will see the remodeling of the alveolar bone as well as cellular cementum that forms at the apex. The three theories of eruption, and the one that we use is the PDL formation or the PDL collagen turnover with the help of the fibroblast traction power. So once again, what are the two factors of pre-eruptive? So the two factors is that the tooth germ, whole movement of the tooth germ occurs, as well as you have the central germ that stays fixed while the periphery, the rest grows. So that is the reason when you have the central incisors that always stay fixed in the middle, and there's no gap because that middle tooth germ stays fixed. So you can see if you have some kind of like oral cavity from the top, the middle, you can say stays fixed, and the everything else grows from that center point. Then how does the successional teeth develop relative to primary teeth? They are always lingual in the successional lamina, except the molars, which develop with the backward extension of the dental lamina. Now we will just do some questions. I will highlight the question and then slide over to the answer on the right. So here we go.